carbohydrates and glycoprotein. We've got lactoferrin, there's two. Remember that in the can, you've got two primary probiotics. You've got the lactobacillus and you've got the bifidobacterium. And as you will know, for those of you that should know your product very well, I'm going to get you to look up the quantity. It's in a unit called CFUs. How many CFUs, for those of you listening, are in colostrum? Because it's a high amount, but I'm not going to say it out. I know what it is. Maybe put your answers into the column, and let's see if you know your product that well. All right, so very important. The digestive enzymes and probiotics in colostrum play a major role. They are added to the colostrum, and they have huge value in gut repair. All right, so we're going to move on to the next slide, which is a continuation of all the minerals and essential amino acids in colostrum. You'll see all the minerals on the left, and you'll be able to recognize and identify a lot of those. Calcium, iron, magnesium, phosphorus, potassium, sodium, zinc, chromium. You've got the whole list there and all your essential amino acids. But I just want to point to the proline-rich polypeptides, which are right at the bottom of this screen on the right-hand corner. Now, you know, I'd love to get more into that, but what I want to point out here is this product, the Cellworks, okay, is primarily made up of PRPs, proline-rich polypeptides. So this is a spray that is made for under the tongue. Aren't I lucky just to have a quick shot of that during the call? All right. This has got a high amount of proline-rich polypeptides in the spray. And why is it important? Because it goes under the tongue into the receptors under the tongue, and it gets absorbed straight into the bloodstream. So it's a phenomenal product, and it provides extra PRPs over and above what you get in the colostrum. So absolutely amazing product. Love that product. Right, why New Zealand? Well, cows are certified, disease-free, non-immunized, and pasture-fed as they would do in New Zealand. There's never been a case of BSE. And for those of you who don't know what BSE is, you might have heard of mad cow disease and foot and mouth. So they've never had a case of that in New Zealand. So for those of you who might be questioning, but aren't you taking colostrum from the cow? Well, you know, the average cow produces 40 liters of colostrum, of which 10 liters is for the calf, and normally the rest would be thrown away. So the excess, those 30 liters, is what we take to use for processing the colostrum. So just for your information, we thought it might be valuable to understand that we only deal in the excess colostrum. We certainly would never think of, and I say we, New Zealand. Okay. So there's a happy cow for you, and if we've got happy cows, we should have a happy colostrum. And this is collected during the first 4 milkings after giving birth. So what are the benefits of bovine colostrum? Well, in one slide, this is going to be 2 slides in a continuation. So all those metabolic disorders that we talk about, diabetes type 1 and 2. So all of this is what it is beneficial for, and obviously helping to look after oxidative stress and aging or anti-aging, stem cell activities for healing and regenerative processes, beneficial in reducing the risk of septic shock. We're going to show you a few slides just now of sepsis in the body and how important and how well colostrum does for that. And that is tied up with deep wounds. Who would have thought you can use colostrum directly onto cuts and wounds so that it reduces the infection and helps the tissue and it helps the wound repair? Very, very important. So obviously the support and treatment and prevention of bacterial and viral infections, and don't forget fungal infections. So I often refer to, sorry, I was just looking at another screen that popped up on my left here. I often refer to the colostrum as shotgun therapy because it covers the spectrum of antifungal, antiviral, and antibacterial. So just remember that. It covers the spectrum of all of that. Upper respiratory tract infections and diarrhea. Oh my word, if you guys have ever had a bad bout of diarrhea, one that goes on for days and becomes chronic diarrhea, I can tell you from my own experience, and that happened about 2 weeks ago, and it works exceptionally fast. Within 12 hours, I had my diarrhea sorted out. We don't know what bug, both my wife and I had a really bad bout of diarrhea. And the only thing that worked very, very quickly was the colostrum powder, and it was able to deal with that infection. And I did top it up with a few other things, but your primary product is dealing with colostrum to assist in that diarrhea. And obviously restoring gut flora by adding the probiotics in the colostrum, and believe it or not, assisting in the treatment of Alzheimer's disease and MS, or multiple sclerosis. So we have quite a list, and this is the last of it, and it's also beneficial, as I mentioned earlier, for exercise performance and lean muscle mass, or reducing body fat, and treating leaky gut syndrome, IBS and IBD. These are all gut issues, ulcerative colitis, Crohn's disease, all those stomach issues that you experience that cause a cascade of problems in the body. You are able to deal with that using colostrum. Now, it also helps in reducing the damage from, we say, NSAIDs, which is your non-steroidal anti-inflammatory drugs, such as Voltaren and ibuprofen, because when they're used excessively or chronically, they start to irritate and hurt the lining of the gut, causing more inflammation. So we don't want that in the gut. We want a healthy gut with as little inflammation as possible. And, also the treatment of allergic and autoimmune disorders, and followed by bouts of influenza or flu, and severe coronary heart disease patients as well. Heart disease, colostrum will certainly play a role in helping anybody that's battling with heart disease. So I hope that made sense for you, and that you were able to look at that list and just get an overview of how diverse this product is. So you can actually see those symptoms, those diseases, and think, my goodness, it treats almost everything. So there the cow jumps into the screen, and what we're showing here is how colostrum was able to, this is a study, by the way, that was used to look at how the insulin-like growth factor, or the IGF-1 that is present in colostrum, had a significant impact on the improvement and sprint performance of ice hockey players and also rowers. So I'm not going to go into the full ins and outs of the study, but those are the study references at the bottom, and you'll see that the rowers increased their performance when taking colostrum during a 4-minute exercise. So these are just 2 examples. There are numerous studies showing how effective colostrum has been in the field of athletes and sports. So as far as body composition and exercise performance is concerned, this was another study showing the effects of bovine colostrum on body composition, and over an 8-week period. And the subjects that were involved in the study showed, if you look at the difference here, your colostrum group had a significant increase in bone-free lean mass. It means they were losing body fat, okay, compared to the placebo group. So let's think about this for a moment. and see if you agree. The number one cause of all illness and disease is immune deficiency. If you happen to go back and rewind to see what it was that caused an illness, you would find the root of it would be a deficiency in your immune system. So we certainly don't want that. We want to be able to have a robust and a reliable immune system, because without it, as we've realized during COVID, you better make sure you've got a strong immune system, because you're playing with your life if you don't. So the root cause of most diseases, the root of it is inflammation, and we just wanted to reference an understanding of what leaky gut is and what inflammation is in the body, and how it affects you. So think about this. So the gut lining makes up about 75% of the body's total immune system, the gut. All right. So we have the organs around the body that the leaky gut in your gut has an effect on, starting from the brain with things like depression, anxiety, ADHD, skin. What about skin problems? Acne, eczema, psoriasis, thyroid, Hashimoto's disease, hypothyroidism, Graves' disease, colon issues, constipation, diarrhea, adrenal fatigue, joints, rheumatoid arthritis or RA, sinus and mouth, cold, food sensitivities and allergies. This is all packaged around leaky gut. So what is leaky gut? Let's just talk about that for a moment. So this is where the germs enter the body via the gut wall. All right. And you'll see that on the diagram, second one down on the right, they start to cause inflammation. They start to break through the junctions in the gut. And these are the undigested food particles that end up going through the junctions of the stomach straight into the bloodstream. The immune system recognizes this as the invasion. It sets up inflammation, and so the process goes on. So this is damage to the gut. All right. So the immunoglobulins and colostrum or antibodies will support this weak immune system and heal and repair that gut lining. So these antibodies adhere or stick to these invading germs. You'll see the bottom picture on the right-hand side. Those are the little yellow ones around the pathogen, are the antibodies binding to that pathogen to take them out of the body. So they do an amazing job in cleaning up. So what happens is that this is a diagram of leaky gut, and you'll see those cells, those junctions as we call them, and you've got a break in those junctions where the food particles sneak through there and go straight into the bloodstream, and obviously set up what I've just showed you, the slide of just now. So leaky gut occurs when you've got chronic inflammation. It causes the gut wall to develop microscopic leaks, which then lead to malabsorption, inflammation, and autoimmune disease. So can you see how this sets you up for all sorts of drama in your gut and in your body? All right. So we spoke about NSAIDs, how these anti-inflammatories cause gut damage, and painkillers, as most of these are, often cause these intestinal injuries. They cause leaky gut because they set up more inflammation and actually damage the gut, causing diarrhea, and also a case of what we call dysbiosis, okay, where you start to get an imbalance of the good bacteria in the gut. There's too much bad bacteria and the balance is really offset. So we need to rectify that balance. So how does that work? Well, the bovine colostrum reduced this. This is looking at the studies and results where the colostrum reduced these injuries by 30 to 60%, guys. This is huge. Reducing that by between 30 and 60% is absolutely huge. It just means you've got a happier, healthier person when you've got a happier gut. So a plain milk preparation wasn't as effective as you can see. So bovine colostrum provides a novel and inexpensive approach. Why do we talk about inexpensive? For the prevention and treatment of gut injuries. Because if you compare the cost of steroids and anti-inflammatories on a long-term use and what you've got to end up dealing with by comparison, colostrum is a far less expensive option. So 7.6 billion people around the world that battle with gut disorders. IBS, irritable bowel syndrome, affects 9% of the world population, guys. And look at this. The ratio of men to women is 2 to 1. 2 women to every guy. So I'm not sure if the women are stressing more or what they're doing, but those are the stats. So girls, we got to help you look after your gut. So they say that the causes are not clear. We tend to differ because that generally would be a comment passed by the medical fraternity, but we certainly believe we know what the answers of those are. Lifestyle, diet, nutrition all play a factor, and it can be a combination of genetic factors and food sensitivities, which can trigger these intestinal infections and stress. So if you don't think stress has got much to do with this, I want you to rethink that, because stress causes an enormous amount of acidity in the stomach. As you stress more, you produce more acid. So you're starting to also cause and add to your problem. So managing your stress is critically important to reduce the inflammation in the body. All right. Another little study of ulcerative colitis. So these are a lot of valuable studies that we look at showing the results on all these trials. This is a randomized double-blinded controlled trial, 14 patients. We just want to look at the results here. I don't want to get into the details from a time perspective, but the control group only reduced symptoms by 33% on mesalazine, and the mesalazine with colostrum had a significant better score, reducing the symptoms by 62%. So certainly showing that bovine colostrum shows huge potential in dealing with ulcerative colitis. And on the next slide, you will see right in the beginning, we discussed Helicobacter pylori, which is one of the primary bacteria that get into the bug, into the wall of the gut and set up gastric ulcers and cause a lot of pain and discomfort. And remember I said that colostrum also has lactoferrin. This is present in colostrum. It's naturally present in colostrum, and you'll see this little bug here, this H. pylori, starts to dig into the that gel layer in the gut, and it really sets up all sorts of problems. So colostrum is also very effective in dealing with that. All right. So several studies that were done showing the effects of colostrum on this bug. Okay. So lactoferrin showing a lot of promise in a lot of human trials, showing a significant advantage in dealing with that bug H. pylori. So, well, do we all know about our grannies and older folk that battle with RA or rheumatoid arthritis? And just looking at those pictures there, we've got an early stage, an intermediate stage, and late rheumatoid arthritis, which is inflammatory, and we call it part of the autoimmune disorder. And at least we can say that because of the probiotics and the anti-inflammatory cytokine effect that colostrum shows is to significantly reduce inflammation on arthritic joints. So if you have people, especially the older folk that you know that are really battling with that, you've got a product that can deliver ease and reduce the inflammation. All right, so lactobacillus showing on this particular trial that if you look at CRP levels, that is a pathology marker that we use to test the levels of inflammation in the body. And the lactobacillus bacteria showed a huge reduction in the CRP stands for C-reactive protein. That's the marker they use to measure when you've got an infection or you've got a bug or you've got inflammation. We use that as a measurement. All right. So flu, colostrum reduces flu episodes and hospital admissions. This was a very big study called the San Valentino study, where they used colostrum for 2 months and followed up every 3 months. And I just want to get to the bottom line here. It was 3 to 4 times more effective than the vaccination to prevent flu in healthy patients. And part 2 of the study, you had 65 high-risk cardiovascular patients, and we were able to see that colostrum had significantly reduced cardiopulmonary complications and hospital admissions. So guys, we've got all of this built into colostrum. It's all there. These are just some of the studies. I've got piles of information regarding how well this does. This is about upper respiratory tract infections. And if you just have a look at the results there, bovine colostrum reduced these episodes of urinary tract infections by 91% and diarrhea by 86%. Guys, that is huge. So we know that it works as a prophylactic treatment of recurrent urinary tract infections and diarrhea. So I did mention it earlier, but here's a slide just showing one of the studies and actually showing how significant that reduction was. So AIDS patients that are, they battle with this particular bug called Cryptosporidium. It's associated with diarrhea in AIDS patients, that the bovine colostrum has a significant effect in dealing with that as well. So there's another criteria that we'll deal with there. And earlier on, we spoke about the gut lining making up 75% of the body's immune system. So we see the scale here, the good versus the bad, okay? And on the right-hand side, this is what we want to see, where the scale is filled with more of the good and less of the bad, because when you've got all the bad side, that scale starts to tip the other way, where you've got all the viruses and bacteria and fungi and parasites overloading the gut. And we call this dysbiosis of the gut. We want to see this starting to happen, where we have more of the good stuff and less of the bad stuff, just as a very sort of easy overview of what that means. So here's a little cheat. We mentioned earlier on how many of the natural probiotics were added to the colostrum, and you can see this is your answer: 1 billion. 1 billion CFU, that's colony forming units, is the measurement that they give to a probiotic. And generally that you need to be able to see on a label how many you get. All right, so the probiotic is the healthy bacteria that colonizes in your intestine, which we call the good guy. And obviously, as you age and deteriorate, and you battle with all the bugs and stuff and maldigestion, and your immune system weakens, you get all the bad stuff coming in. So this was just a study on high quality probiotics that are added to colostrum that come from a Danish company. I'm not sure if this particular company is the one that supplies New Image, but certainly there is huge value in probiotics. So right, so this is just a little slide of showing you from birth to old age, and then you've got a count on the gut flora on the left-hand side of the screen, and you'll see how things start to change and deteriorate as you get older. They start to increase, where the good bugs start to come down and the bad bugs start to increase. So the gut flora does change with age. So naturally, as we get older, we want to start adding more of this natural flora, the good bacteria, into our gut, so we can try and reduce or keep the balance, a much healthier and a happier balance in your gut, right? So, Alzheimer's disease, wow, isn't that just a nasty diagram of shrinkage of the brain there? So there are several factors that are considered here, that genetic, head injuries, depression, hypertension. So what did I mention early on about proline-rich polypeptides in your colostrum? All right, this is a hormone in a bovine colostrum that regulates the thyroid, the thymus gland. And what it does is help balance. It's a great communicator. It helps communication between cells, but it's also an immune modulator. So it takes an overactive immune system and it helps to balance it and bring it down. And an underactive immune system, it helps to bring it back into balance again. So it's quite an incredible peptide in colostrum. It's also called colostrin, is another word for it, and it can only be extracted from colostrum. It only comes from colostrum. You can't get it any other way. All right, so there is the name, colostrin, and this was used for treating Alzheimer's disease. This was another study, so I'm not going to get too detailed with that, but it was just showing how effective the proline-rich polypeptides were for Alzheimer's disease. All right, MS, multiple sclerosis, many people battling with this at the moment. The virological and immunological studies suggest that MS is an autoimmune disease triggered by a virus. So as we know, colostrum is a phenomenal antiviral product. And while we're talking about viruses, guys, Viranox is loaded with antibodies, way higher than our standard colostrum, and it does have the bovine colostrum in it, but this is your what I call shotgun therapy for virus infection. So remember, it is now officially launched, it is available, and keep this in mind when it comes to dealing with bugs like viral bugs. A phenomenal product. You guys have done your homework. Well done. Right. So, yeah, let me not get too detailed. These are just a few more of the studies. Oxidative stress, you know what that is. It leads on to free radical damage, aging, and cancer. So colostrum is very, very good at helping reduce oxidative stress. And if anybody doesn't know what oxidation is, okay, I'll give you an example. If you take a bite into an apple, okay, and you leave that apple for maybe 10 or 15 minutes, you will start to see that portion of the apple that you bit into start to go brown. That's oxidation. That happens at cell level. And all these things affect a cell. Okay, free radicals, excess sun, pollution, stress, poor diet, they damage the cell. They damage around that outer layer of the cell. And obviously, we don't want that. We don't want damaged cells, which lead to aging. We want to keep our cells happy and healthy. So remember that colostrum is very, very important in oxidative stress or reducing damage to cells. All right. So we did mention that colostrum also contains glutathione, which is a powerful antioxidant. And glutathione is a scavenger of these free radicals. It helps go around and clean up and really reduces the amount of free radicals in the body. So an antioxidant and oxidation, I hope you now kind of realize the difference between the two. So oxidation is that bad stuff that happens to the cell. So a product that's classified, or a component that's classified as an antioxidant, helps deal with that. All right. So there we have it in a circle there. That's just a bit of the technical information. I don't want to get too wrapped up in that. And anti-aging and the effects of human growth hormone, okay, in men over 60 years. This was another study, all right, showing how the IGF-1, due to the reduction of IGF-1, remember IGF-1 comes in colostrum, so when you have a big reduction in IGF-1, you have a decrease in lean body mass, and you also have the development of adipose or fat tissue. All right, so we need an adequate level of IGF-1, or the human growth hormone. All right, this also leads to thinning of the skin, and this was a little study that was given to 21 men aged 60 to 80. They gave them the human growth hormone, IGF-1, this was 3 times a day for 6 months. All right, look at the results. It restored and improved the health and appearance by gaining 8.8% in muscle mass. They lost 14% fat, and they increased the thickness of the skin as well. I don't know what the percentage was, but I think that's also showing one example of this component in colostrum, what else it can do. And look at the age, guys. This is aging, right? 60 to 80 years old. So if we can do that and reverse aging, this is one of the ways of one component in colostrum that helps us get there. All right, diabetes is a big deal these days, guys. So this is showing how bovine colostrum reduces glucose, blood glucose, cholesterol, triglycerides, and ketone levels in a type 2 diabetic patient. So let's just go straight to the results. Total cholesterol and triglyceride levels decreased significantly after 4 weeks, and the conclusion was that bovine colostrum is beneficial in decreasing glucose, ketones, cholesterol, TG levels in type 2 diabetic patients. We always put the reference at the bottom of the page, so this is not something we've sucked out of thin air. It is one of the studies we've been able to take just the information, the necessary information from the study, and just reference it down at the bottom. All right, now, I did mention early on that we wanted to show something about using colostrum for dressing, the dressing of wounds and deep wounds. And these slides, I believe, were made available to us from Dr. Gerhardt down in Cape Town, who's a hematologist. And they wanted to show how effective colostrum was in dressing the wounds. So you'll see here, this is putting the powder onto a gauze, all right, on the left-hand side of the screen here. 15 days later, okay, if you take day 15 on colostrum powder and then the conventional dressing on the right-hand side, that wound is hardly changed and cleaned compared to the one in the middle. This is using colostrum. So it is helping repair tissue. So this is using the colostrum powder packed onto a dressing and used direct onto the wound to help heal and seal that wound. So if it's doing this on the wound, remember that it's also doing it internally into the gut. Okay, so I had an experience where my wife and I were down in KZN, we were on our bicycles, and we turned around to go, to make a U-turn. And at the time, she got her feet wrong on the pedals, and she fell into a fence, which caught her on the arm and sliced her arm open. And this was a rusted fence. And I was really worried about it because you don't want a really rusted fence to gash into your arm. So we raced home on our bikes, and I packed colostrum onto that wound. This was my own experience of dealing with this. And I can tell you that by the next morning, all we saw was a small line. There was no infection. There was no redness around the area. That gash on that arm, we packed it with colostrum. I strapped it up using a gauze, and we put the colostrum in, and I only knew about this as a result of knowing this. So for those of you that really want to know a bit more about the application in colostrum, I think this provides huge value. All right, this was one of the patients in Cape Town, and just showing how amazing that this wound on the side of this patient had healed up significantly, and keeping the wound clean, no further infection. This is the main thing when you're dealing with wounds, guys, is infection and sepsis. When the sepsis gets into the blood and into the body, you've got a real fight on your hands. So we don't want that. And we've seen how important colostrum is in dealing with sepsis. All right. It plays a massive role in infection. So, right, let's jump ahead. So just a brief looking at, three other products, which is the Alpha Lipid Lifeline tin in the powder form, the capsules and the tablets. So we have a look at each kind of breakdown here, where you can mix it into a drink on the powder. It's got the extra nutrients. The capsules, if you don't want to taste the product and you want to just swallow a capsule, and the tablets if you don't like to swallow capsules, but you don't want to mix a drink each day. So it's the convenience about taking colostrum on the go. Okay. I personally love the taste of it. So, but sometimes it is convenient if you're traveling to take the tablets or the chews with you, so you can just pop them as you go. All right. So very convenient there. Colostrum is a fantastic product for stem cell activity, anti-aging, healing and regeneration. The cell works. It is an older picture, but we're just talking about the cell works, this one here. All right, this is the one we're talking about, the new cell works. Sorry, I just dropped something onto my screen which moved the slides. And the ImmuFort, which is the product that was available prior to the Viranox. Okay, so it's a phenomenally good product. It's very powerful in supporting the immune system, just like the Viranox is, but the Viranox is kind of like a fortified ImmuFort, and it has a few extra added ingredients into the Viranox that the ImmuFort doesn't have. So guys, I hope that helps you. This has been an overview, and I didn't really want to rush the slides, but I hope that's given you a better overview of the products, how to use them, but a much better perspective on colostrum as just an entity, a product on its own, which has been put into all these individual products. So I hope that's given you a better overview and a better perspective. And I'm going to ask Vinesh to come back into the screen here, because I know that we mentioned we want a book available, and I want you guys to receive a copy of the book so that you can use it for yourself, and obviously to send copies to your friends or family. So Vinesh, what I'm going to suggest is that would you like me to make the book available through you at New Image, and guys can download it from there, or would you want them to go to our website? I'm quite happy to do that.
That's perfect, Doc. I think what you can do is you can send us the link. We've got a presentation coming up next week. We'll then post it out onto that presentation, and the guys are welcome to download it on that presentation. So that'll be early next week. Fantastic information, Doc. Always so much to learn, right? And we want to thank you for your time today, and obviously all that valuable information. Lots of stuff to learn on here, but thank you so much for your time. I would like to now hand over to our Regional Director of Africa, Mr. Chris Roger Perry. I believe, sir, you have some stuff to give away, so over to you.
Thank you, and thank you, Dr. Hofer. I've got much more than stuff to give away. We've got one of the legends in our business on this call today, one of the superstars that actually helped to get our business going globally. One of the superstars in Malaysia, one of the first diamonds in Malaysia, one of the key people who I recognize around the world for their loyalty, their leadership, the energy that they put into getting to be one of the first diamonds in New Image, and one of the first $1 million earners in the world. So I'm very privileged. I've spent a lot of time with her and her husband in Malaysia, and her name is Nick and Moharina Muhammad. And I've just asked her whilst Dr. Hofer was talking if she would share her testimonial with us, seeing that she's on the call. Vera, I feel very privileged to have her on the call today because she's one of the outstanding role models for what the colostrum can do and the inspiration for thousands of people in Malaysia and other Asian countries around the world. So if you're there, Maharina, or Rena, Pam and I call her Rena. We've known her for a long time. Would you like to come on and just share your testimonial about how the colostrum has helped you to reinforce all the stuff that Dr. Hofer's been sharing with us over the last 45 odd minutes? So if you're there, that'd be great to have you part of the call.
Yes. Hi, everyone. Hi, I'm Moharina from Malaysia. Assalamualaikum to those Muslims. And been with New Image for 20 years. You know, can you imagine how many testimonies that we've been collected for 20 years? And so far, I would say that Colostrum did give hope or a new life for many people in Malaysia. And our recent testimonies is cancer stage 4, you know, how they recover. The testimonies here are all on chronic disease, like Chris, you've been here in Malaysia, right? So the testimonies we collected are all amazing recovery. And I just want to share here that when people take our products, they love it, they see the recovery, and they repeat orders. That is your passive income in New Image. Thank you so much, Dr. Anthony, for your very informative information just now, and we understand more about colostrum now. Thank you so much. Thanks, Chris, for this opportunity. Hope to see you in Bali.
Yes, thanks, Moharina. It's always a pleasure to meet you guys and rub shoulders with winners in the game and the game of life and the game of New Image. So thanks for coming on there very quickly. I do have one more testimonial that a person, Jane Sharda, she's from Uganda, and I see Ethel on the call here, Vincent on the call, and a lot of other members from outside of South Africa on the call. So well done. Congratulations being on the call. But Uganda is going to hear a lot more from Jane Sharda. She's currently a member, but for 2 years she had quite a large goiter growing out the side of her neck. And she got introduced to the alpha lipid just late last year, around about August, September, and she was introduced to the colostrum by one of her doctor friends, a medical doctor, and she started taking the colostrum, and within 2 weeks, you know, you heard Dr. Hofer talk about inflammation and all those things that create the diseases and promote them. Well, in 2 weeks, Jane Sharda, the goiter started to reduce in size, and it actually sort of transferred itself around to the front of her neck. And now you can hardly notice her. Pam and I were up in Uganda there about 3 or 4 weeks ago now, and I'm not a doctor, but there was a doctor in the audience, and he said, "Let me have a look." I think I can see it, a little bit of it, but for the average person, you would never know that goiter was there. So these are truly amazing products, and we obviously we've got lots of stories like that around the world. Nick and Maharina have seen thousands of those. But Dr. Ants, I'd like to thank you once again. We've done lots of miles together over the years, and traveling, telling the story of colostrum, and we got lots more work to do yet around the world, not only here in Africa, but all around the world. So one thing that a lot of people should realize in this direct selling industry is there's a number of companies that have got good products, but very few have unique and completely natural products which deliver on the promise. I'll just say that once again. There's a lot of good companies out there in the direct selling business, but very few have unique, completely natural products which deliver on the promise. So I want you to think about that and make a note of that when you're sharing the message of Colostrum with people as you journey through your journey with your image. All right, so thanks, Dr. Hofer. Very valuable information as always, and we look forward to reading your book. A couple of things on a company level. We've got the big conference coming up in Bali, and that's next week, the 9th till the 14th. I'd like to congratulate Neri and Hansi, our two executives, Emerald executives here in South Africa. They're off to Bali, and I know you're on the call here, Neri, so congratulations. I know you'll have lots of fun there, and join the other members from South Africa as well. The theme for those on this call here, the theme for the conference in Bali is "It ain't stopping us now." It ain't stopping us now. And the other one is "Whatever it takes." Right, so they're two good theme songs, and I know that they're going to get belted around in Bali there. Lots of excitement, lots of fun, and lots of bonding with other leaders from around the world. It's so amazing now. So what's happening? What is it? 30 when I joined, 84 to 89. That's 5 years. When I joined 34 years ago, New Image, I never thought I'd be sitting here in South Africa talking to everyone, or the audience online today. I never thought we'd be going to places like Bali, a five-star paradise. So much beauty over there, to share the wonderful experiences with all the people that are going to be there. I think it's just wonderful. So congratulations. I know there's going to be lots of learning there. The other announcement is we have a new operations director for Africa, actually. A new operations director, someone that's going to be running all of Africa. Our replacement, Pam, and I will be heading back to Australia at some stage once the new team here in Africa have got their feet under the table and are confident that they can manage the business moving forward. So we've got a new a person called Leoshni Dwaka. I'm not sure Nuri probably can pronounce that much better than I can, but she's a wonderful lady. She's been through a very rigorous interview process, not only with myself on a number of occasions, but with the CEO in New Zealand and the chairman. They've had lots of input into the selection process, because we want to not only take the business to another level here, but also take it to another 5-10 levels here. And we need local people who talk like locals rather than foreigners like us to make it an African business. So we welcome Leoshni to run the operation in Africa here. Just a couple of dates that you should write down. One date is the 18th of March. And Leoshni will be doing a big welcome to Leoshni and KZN here at our office, and she'll be not only be welcoming her, she's going to be sharing the vision that she has for Africa, how she a few ideas on strategic plans of how to achieve the growth that she knows that is available there, and most importantly, how she's going to implement it with the team here in Africa. So a lot of things to look forward to on the 18th here in KZN. And on the 25th, we're going to be welcoming her to Gauteng, right? And she'll be introduced and doing the same format for the welcome and introduction and the vision that she's got for Africa as well. So make sure you get your teams revved up. She's off to Bali with the person Jane Sharda from Uganda. Lucky people, only not even working the business yet, but off to Bali already, because it's such a unique opportunity for the new leaders to be able to rub shoulders and really get the confidence and belief that everything's possible with New Image. The only thing that's not possible is monitoring your attitude towards doing the business. So everything else works, the products work, the company works, and all you need to do is apply yourself to work the system and produce the results, not for the company, for yourself. when you succeed, the company succeeds. So not the other way around. The company can't succeed without its members succeeding. So there's a couple of important dates for you coming up. Just a couple of other things too is the top income in New Image in Taiwan and Vietnam in the last conference in December was just on 4 million rands, which is 400,000 New Zealand dollars in the month. That's an 83-year-old couple from Taiwan originally, but they were in the Vietnam conference there. So there's huge incomes to be made, and we know that income's not everything in life. The most important thing is your health, because without health, you can't create income anyway. It's pretty difficult anyway. I guess Shamima knows that better than most on this call here today. But certainly having a secure, stable, sustainable business is certainly one of the keys to keeping yourself propped up and having a healthy long-term life and reducing stress. So that's another sort of key there for you. So a couple of questions here. I said that at the beginning that I'd had a couple of questions here for the guests and the members who might want to win one of our beautiful Colostrum capsule products. They've got a retail value of just over 1,000 rands here in South Africa. So if the guests have got their finger on the laptop or on their phone, here comes the question. And as soon as the first one to type it into the chat box there wins the 1,000 bucks worth of product. That's the retail price. All right, so here we go for the guests here. How many times more potent is bovine colostrum than human mother's colostrum? How many times more potent is bovine colostrum than human mother's colostrum? So it's got to be a guest, not a member, right? So I know that Venetia's got his finger on the trigger there with Shamima, and they both know who the guests are. So that's the question for the guests. Now, the question for the members. A bit more trickier for the members, and so that's how it should be as well. So for the members, what level do you have to be at in South Africa to qualify for the country pool? What executive level do you have to be at to qualify for the country pool bonus here in South Africa? All right, so there we go there. So no doubt. So who have we got there, Vanish? You can come back on the show now and tell us who are the guests. Who's the guest that won? The first question: How many times more potent is the colostrum, bovine colostrum, than the human mother's colostrum?
So,
are you there, Vanish?
Yes, Chris, I am here, just going through the answers. Quite a bit of answers here that came through. I think on the member one, we have Shamima with 2-star silver, right?
Right.
And
yes,
I think your
correct.
question.
Okay.
All right.
She's always got a finger on the button, ready to push it. I don't know how. I think she's got a finger taped to the button, right? The enter button.
Yep. Just behind her was Suraya, so all of them always on the go with the buttons. And then
we only got one prize though. Yeah, sorry about that. Yep. And the guest.
And tell me, does this apply to our international guests online as well, or just South African guests?
Well, it's a bit difficult because it's hard to. It costs more to send the products over there than it does but we can sort that out later. Who is the first person then?
I think I see Mohazina Mohammed. I hope I got that right.
All right, she's a Malaysian member, is she?
That's correct. It looks like it. That is correct.
All right, what we'll do is we'll give yep, congratulations, great to be on the call. What we'll do is we'll give a bottle of product to our new operations director, Leoshni, and she can take a bottle over there, or we'll give it to actually Neri and Hansi might be able to transport that for us, and they can take it over to Bali and give it to the young lady.
Perfect.
So there we go there. All right, so we'll always find a way. Nothing's impossible with New Image. The only thing that's impossible is if you think it is. All right, thanks, Vanish. Thanks, Dr. Hofer. And thanks, everyone, for being on the call this afternoon. Great to have you part of it. And especially Rina, Moharina Mohammed, certainly a superstar in our business. Great privilege to have you on the call. Thanks a lot.
Awesome stuff. Thank you so much, Chris. And thank you everyone for joining us today. We'll be back next week on Monday. We've got our Cycle 1 training. Those flyers will be out. I think I've already sent them out. So we'll catch you at 7:30 online again. Thank you so much and have a great evening. This is your Network Development Manager for South Africa saying good night, God bless, and goodbye.